and we're here today with Manny Vela, who's a member of the AltaCair Foundation board here in the Rio Grande Valley. Tell us more about that foundation, Manny, because we've been writing a lot about the group, and I've learned today that you're on the board.
I am. I'm incredibly proud to be a founding member of the board. Rashmi and all of our fellow board members are completely aligned, Steve, in regards to wanting to do what we possibly can to help those members of our community throughout our communities in South Texas who don't necessarily have access to the things we take for granted, right? Whether it be healthcare, transportation, access to utilities, all of those kind of things. And so I love the way AltaCair is evolving in regards to how we're looking at this. And we're having clusters, as you mentioned previously. You've participated in some of those clusters. Thank you for the attention you're giving to AltaCair, because it sheds light on the need that we're trying to address and the challenges that we're trying to address. And so AltaCair is we're going through these listening sessions at multiple levels and industries throughout the valley in an effort to try to gain as much knowledge as we can about the challenges that folks in colonias, for instance, face. We're concentrating right now on a number of colonias in Hidalgo County with the thought process of establishing a pilot project. And the whole thought process right now, which is subject to change as we learn more and more, is act as a central repository where we can provide roadmaps for people who live in those type communities who don't have some of the basic infrastructure that we have access to, et cetera. But we can provide a roadmap as to what opportunities exist either through governmental agencies, private corporations, for-profit, not-for-profit, does not matter, or individuals in our communities who want to try to help. And so we're in the early stages of developing our strategy in that regard. But I couldn't be more proud to be participating with an organization who is concentrating on helping those around us who at times, many times, don't have a voice to help themselves. So that's our goal.
So I learned that you were part of that group when you co-moderated the healthcare cluster. That was really well attended. Stakeholders, lots of non-profits there. Anything that you learned? I know you and your co-moderator Todd Mann was making notes furiously about all the ideas that were coming forward. Anything specific in that cluster that grabbed your attention? Yeah,
what I appreciated is all of these different individuals representing their groups came to the table with solutions that they're currently implementing throughout our communities. So there are roadmaps out there as we sit here today. The challenge for us is how do you extend those roadmaps into colonias, right? And I think that's one of our biggest challenges. And then funding is a big obstacle, and I'm not talking about funding the corporate foundation, I'm talking about funding these services. A lot of the folks we talk to are able to perpetuate because they have funding from other sources, whether it be insurance, et cetera, otherwise. And so if you think about it, Steve, a lot of times folks in the colonia environments, certainly the colonias that we're talking about, which we've prioritized them by need, don't have those type of funding sources available. They don't have health insurance, right? They don't have transportation. And if you don't have transportation, how are you going to get to the doctor? How are you going to get to the grocery store? How are you going to get to a job, right? And so we're trying to make sure we cover all of the obstacles, all of the challenges. So we're doing it on a 101 style, right? We're going to understand the basics and go from there.
As you brought up transportation, that was one of the top issues that came out from that meeting, that so many of the groups said it was like a number one issue within the colonias. They want more buses. Right. Not more, they just want some buses. Yeah. And that was very much a top issue.
Yeah, I'm so proud to be overseeing the Colonia program established by Texas A&M several decades ago. And quite honestly, when I came into my new role almost a year ago, my assumption would be that the number one or number two issues were there were going to be food insecurities or utilities, et cetera. It's transportation. Right, and so I learned that pretty early on in my tenure, but it makes sense if you think about it, right? Because you can't address your food insecurities if you don't have transportation. And it could be as simple as somebody even bringing stuff to you, but those pipelines don't exist right now. So it's absolutely going to be a big part of our conversation, which is how do you address the transportation issue, but we're not going to lose sight of the other challenges as well. provision of health care, lack of utilities, lack of proper drainage, et cetera, right? So there's a myriad of issues, but like I said, we're not trying to solve the problems of the world. What we're trying to do is act in a manner to coalesce services that are already provided by so many different folks, entities. Hidalgo County's doing a great job with the Prosperity Task Force to address this stuff. Then you just go down from there. There are layers in each direction, and we're just trying to coalesce all of the groups so that everybody has that consistent roadmap, which in our minds would enhance their opportunities to receive transportation services, to receive assistance in regards to utilities, to receive assistance as it relates to the provision of healthcare, all of those kind of basic things.
And there was a very some impassioned remarks from Eddie Olivares, Hidalgo County Public Health Director, and he was saying one of the top issues for him is housing, substandard housing.
Right.
If you don't have good housing, you're going to get sick.
Yeah, it's the environment in which you live, right? And for the policymakers out there, this isn't. I'm not talking about the cause, right, of the issue with colonias. I'm talking about the impact. What exists today, what environment are some of our folks in Texas living in? And I'll also say this, there are many colonias who have evolved beautifully, right? All of those services that we're talking about are being provided and offered in those environments. And so I commend those communities. We're talking about those communities who have not risen to that point yet, right? And we're talking about the health and well-being, their living conditions, et cetera. And Eddie's spot on. If you don't have a healthy living environment, a healthy living condition, then all of these things sort of spiral out from that nexus right there. So he's absolutely right to point that out.
And we also learned that the number of colonias is not decreasing.
No.
If anything, it may be going up almost 1,000 in Hidalgo County.
Well, and as we talked about a few minutes ago, the challenge is there are multiple definitions of what a colonia actually is in today's world in 2024. So as I suggested to you, I think one of the conversations we need to be having is, okay, let's redefine what colonia, the definition of colonia should be in 2024. And then we can start talking about how do you prioritize from a needs-based perspective, right? But get clear on what the definition is, because if you're not clear on that, then the number's going to be skewed based on the different definitions, if that makes sense.
Last question. Another thing that came up, possibly an age-old problem down here, that too many of these groups work in their own silos, and people not communicating with each other and not sharing resources. Right. You must have heard that.
Well, and that's part of the challenge, right? But another reason I'm so proud to be with AltaCair is that's what we're trying to fight against, basically, or fight against. It has a negative connotation. Let me turn that into something positive. We're trying to be a positive force and catalyst to bring those folks to the table simultaneously, right? So that when we're talking about a comprehensive roadmap, a comprehensive list of help, that it does involve all of these incredibly well-intended folks, by the way, incredibly well-intended, right? And I'm not suggesting other folks aren't already doing a good job of coalescing some of these folks. We want to take it as far as we can in regards to trying to get as many of these folks and agencies and entities at the table at the same time, so that when we start talking about an actual, true, comprehensive roadmap, it's as comprehensive as we can get it. So I commend anybody and everybody who not only try to help folks who live in those environments within colonias, but across not only the valley, across the state of Texas, across the country, and across the world. Look, Steve, we're in this deal because we're aligned in regards to wanting to help folks around us, right? And if this is the opportunity we have, the best shot we have, let's go, right? And I do like our chances. I like what AltaCair is doing. Rashmi's a great leader. We've got some great folks who are participating on the board as advisory board members. Let's go, right? Let's go make a difference.
Well, Manny, thank you so much for today's update on AltaCair Foundation's work. Thank you.
Thank you very much, Steve, as always. We appreciate the Guardian tremendously.